Hello, welcome back. Uh, this is the second video about the courses offered at NIMHANS. In the past week, we saw the postgraduate as well as MPhil programs offered at NIMHANS. So in this video, we will be looking at the PhD program, that is the doctoral programs, and the postdoctoral programs offered at this prestigious institution of national importance situated at Bangalore, which is involved in cutting-edge research in the area of brain, mind, and behavior axis. So moving on, just a quick recap of what we found last week. NIMHANS is as a center of excellence, medical college and research institution functioning under the Ministry of Health and Family Welfare. It's a deemed university headed by a director vice chancellor, and so we will move to the courses now. So last week we dealt with postgraduate as well as MPhil courses. So we will see what are the courses, PhD courses offered under which what are the disciplines you can do PhD there. So PhD in clinical neurosciences is an Indian Council of Medical Research program. To be eligible for this, you need to be a doctor, allopathic doctor with an MBBS degree, minimum 55% marks with MCI recognition. PhD in biophysics, to be eligible, you need to have MPhil in biophysics or a neuroscience MPhil or an MBBS or an MSc in biophysics, physics, biochemistry, biotechnology, life sciences, or physiology. A PhD in biostatistics, to be eligible, either you have to be an MStat, Master of Statistics from Indian Statistical Institute, MSc in statistics, biostatistics, medical statistics, health statistics, or agricultural statistics. The charm or the beauty of NIMHANS courses are that it is very unique in character, and more or less it's very interdisciplinary, because NIMHANS is an autonomous institution. They have all freedom to design and execute any kind of programs. So you may not find all these programs in conventional universities. PhD in child and adolescent psychiatry, MD in psychiatry, DNB, MD or DNB in psychiatry. DNB is another degree which is equivalent to MD degree, that is post-graduation in medicine. It's under the diplomate, it's under the National Board of Exams, NBE, and DNB means diplomate of the National Board. Or you need to be a clinical psychologist or a psychiatric social worker holding an MPhil, 2-year MPhil degree. So PhD in clinical psychology, you need to have an MSc, MA in psychology, or counseling psychology, psychological counseling, clinical psychology, applied psychology, or an MPhil degree in mental health and social psychology, 2 years, that is equivalent to clinical psychology. Nowadays there is no that nomenclature is not there in any institution. Now it has been homogenized, like MPhil in clinical psychology. The degree is named as clinical psychology only. Earlier there were many such variations, so RCI has made it uniform now. PhD in human genetics, another very interesting area. You need to have an MSc in any of the life science discipline, so it's open to many. PhD in neurochemistry, you need to have an MPhil or an MSc in biochemistry, MSc in medical biochemistry, or MSc in biotechnology. PhD in neuroimaging and interventional radiology. It's also a very cross-disciplinary, multidisciplinary area where technology and medicine shake hands. So you need to have an MBBS. After MBBS, you can directly apply, or if you are an MD or a DNB in radio diagnosis, or an MSc in medical subjects, or an engineer with BTech or BA or an MTech. PhD in neurological rehabilitation. These are all like very uh, I- very application oriented courses. Neurological rehabilitation assumes great significance in the face of uh, those who are having neurological disabilities or disorders, those who cannot walk, those who cannot speak, or after any head trauma, some of the cognitive functions get lost. So how to bring back all those lost functions? So there is a separate department of neurological rehabilitation at NIMHANS, and the patient care is extremely wonderful. And so they are experts. So there is a course also. You can do a PhD in neurological rehabilitation. Many disciplines converge. See, from you can be an MBBS, you can be an MPhil in physiotherapist also can come there to do this, and masters in occupational therapist, masters in orthotics and prosthetics, MPhil clinical psychologist, psychiatrist, social worker, and MSc in nurse, a speech therapist, or a doctor with a PG degree in physical medicine and rehabilitation. PhD in neuromicrobiology. MBBS or MBBS, they are an MD in microbiology, or a BE, an engineer with biotechnologist. MPhil in neuroscience, MSc in medical microbiology, biotechnology, molecular biology. MLT is medical laboratory technology. So if you are an MSc in medical laboratory technology or a laboratory technician, then you are suppose you can apply there. Applied microbiology, biochemistry, biomedical genetics, and neuroscience. PhD in neuropathology, again a very wonderful area to work. MD in pathology, or MSc in life sciences. PhD in neurophysiology. You need to have an MPhil in neuroscience or neurophysiology, or an MBBS, MD in physiology, or MD in Ayurveda. You are a PG holder in Ayurveda medicine. You are eligible. BTech as engineer with electronics, electrical, computer science, or biotechnology specialization, and MSc in physiology, biochemistry, anatomy, neuroscience, life science, biotechnology, zoology. Physiotherapist with master's degree, or a Unani doctor with MD in Unani, PG in Unani medicine. PhD in neurobiology. MBBS or MD in microbiology. MSc in medical microbiology, biotechnology, virology. These all can apply. PhD in nursing. MSc in psychiatric nursing. Should be a psychiatric nurse. Not only BSc, you need to have a postgraduate degree in nursing, that too in the branch of psychiatric nursing. PhD in psychiatric social work, you need to have an MSW or an MPhil in psychiatric social work, 2 years. PhD in mental health rehabilitation, again it's as I had told you, it's a very cross-disciplinary area. So a clinical psychologist, a psychiatric social work, or has a person holding an MBBS or a nurse, psychiatric nurse, and those who have an MS in psychosocial rehabilitation can also apply. So DM in so we have actually covered the PhD degrees. So now we come to the super specialty course, that is after MD, post graduation in medicine. It's a PhD actually. It's called a super specialty courses in medicine. So DM is a 3-year course again. MD is also a 3-year course. So DM in neuroimaging and interventional radiology. So you need to have a MD in neuroimaging. To be eligible for this, only MD holder will be available, doctors. 4 seats. DM in neurology, again a person with MD in neurology, 10 seats are available. DM in child and adolescent psychiatry. This is a DM degree, post MD degree in psychiatry. This is offered only at NIMHANS. Child psychiatry is the only place where you can do a DM in psychiatry in India, that is NIMHANS, and there also its specialization is in child and adolescent psychiatry. And again you have a DM in addiction psychiatry, again psychiatric specialization in super specialty area. This NIMHANS only has as of now. DM in neuroanesthesia, so you need to be an anesthetist, that is an MD in anesthesia, an anesthetic specialist. DM in neuropathology, again a neurologist, and having a DM MD in neurology. MCH in neurosurgery, so you should be a neurosurgeon, that is an MSc, not an MSc, MS, Master of Surgery in neurosurgery. So you can go for a it's a surgical super specialty. So DM is a medical super specialty. After MD you go for DM, and MCH is after Master of Surgery, that is MSc, you go for the MCH is the super specialty course in surgery. Again, other than this, you have postdoctoral fellowships at NIMHANS. So to be eligible for this postdoctoral fellowship in child and adolescent psychiatry, you need to be an MD or a DNB in psychiatry, that is a psychiatrist. Postdoctoral fellowship in neuroanesthesia, you should be an anesthetist, MD, DNB in anesthesia. Postdoctoral fellowship in neurocritical care, very critical area. Obviously, MD, DNB in anesthesia, MD in internal medicine, that is MD in general medicine, DM in neuroanesthesia, DM in DNB in neurology, or MCS DNB in neurosurgery. Postdoctoral fellowship in neuroinfection, you need to be a microbiologist, but you need to be holding an MD degree, post MBBS MD degree in microbiology. With MSc degree you can't apply for this. Postdoctoral fellowship in hospital infection control, MD DNB in microbiology, again a microbiologist, doctor, post MBBS MD in microbiology, 3 years. It's MD span is 3 years. Postdoctoral fellowship in neurology, it's for MD in those who hold MD degree in neurology. Postdoctoral fellowship in neuropathology, that is also for people who have an MD in in pathology, post MBBS MD pathology. Postdoctoral fellowship in transfusion medicine, interesting. MD DNB in pathology, medicine, pediatrics, microbiology, again many of the specialists can apply for this, or even a specialist in emergency medicine or any other clinical equivalent degree recognized from a it's recognized from a recognized institution. Recognized is repeated 2 times. Postdoctoral fellowship in neurological rehabilitation, again MD in physical medicine and rehabilitation. Postdoctoral fellowship in acute care and emergency psychiatry. So separate 1 year. This fellowship, postdoctoral fellowship, is a 1 year course. Please note. You need to be a psychiatrist, so you can have an postdoctoral fellowship in acute care and emergency psychiatry from NIMHANS. Postdoctoral fellowship in community mental health. So also you need to be a psychiatrist. Postdoctoral fellowship in addiction medicine. Again, you need to be a psychiatrist with an MD or a DNB degree in psychiatry. Postdoctoral fellowship in consultation liaison psychiatry. Again, MD DNB in psychiatry. Postdoctoral fellowship in geriatric psychiatry. MD DNB in psychiatry. Postdoctoral fellowship in obsessive compulsive disorder and related disorders. Again, MD DNB in psychiatry is eligible. Postdoctoral fellowship in clinical neurosciences and therapeutics in schizophrenia. MD DNB in psychiatry. thank you for watching this video. So as usual, we will build up uh, um, by hearing from you. So please mail at primepubliccharitabletrust@gmail.com with your valuable inputs.